BC's health minister is vowing to protect the province's network of overdose prevention sites after federal Conservative leader Pierre Poilievre promised to scrap them should he win the federal election. For more on that, let's bring in Rob Shaw at the BC legislature. So, Rob, what exactly could BC do here if Poilievre is elected?
Well, Stacey, actually very little if Poilievre wins and follows through with his threat to end the overdose prevention sites, because the drugs at play here are illegal and BC absolutely needs those federal exemptions to open and continue to run those sites. Nonetheless, the health minister today leaping to their defense, saying they are vital parts of BC's response to the ongoing toxic drug crisis, despite some concerns. Poilievre did say Monday that he would force the closures as part of a shift to fund abstinence-based addictions recovery models. The federal Liberal leader Mark Carney said he'd order a review, though there's no real details on what that could look like. BC has around 50 overdose prevention sites. They're mostly temporary. Some of them are just tents outside buildings where addictions peers test drugs, monitor colleagues for overdoses. Critics say their kind of ramshackle nature can lead to street disorder, open drug use, and neighborhood disturbances. There are also 5 supervised consumption sites, permanent spaces with higher quality care, medical staff overseeing them, and links for services for people, including one here on the island on Pandora Avenue. Both types require different federal exemptions. Overdose prevention sites always meant to be temporary, but BC's health minister today calling them that part of fighting the toxic drug crisis, the frontline part. The toxic drug crisis has killed more than 16,000 people. The opposition saying they need to be changed, if not scrapped entirely. Here's both sides of that.
Overdose prevention sites remain an important part of the continuum of healthcare that people need to access for treatment and recovery, so we'll continue to provide those services to people. It's important that communities are safe, patients and workers are safe, and that's why minimum service standards are an important part of this.
I'm glad that we would see some leadership at the federal level to stop this practice, particularly here in BC, of sometimes having activist-led sites, people whose primary role seems to be advocating for the legalization of drugs, anti-police advocacy. We need to treat this as a healthcare problem, and that means actually having standardized healthcare services and tracking the results that we're going to be getting or not getting from these services.
The health minister promising new standards and guidelines for the overdose prevention sites to try and address some public concern. She's also not ruling out court action. There have been previous court rulings to protect supervised consumption sites. Stacey, this will depend on the outcome of the election and the next moves by whoever becomes the next prime minister. Stacey?
One more thing on the table pending the outcome of that federal election. Thanks so much for the update on that, Rob. Appreciate it.